Women come in with an image in their brain of what they want their breast to look like. It may have been someone that they saw, it's a fantasy breast, and sometimes I ask them to bring me a photo of their ideal breast. We try to give them what they want, but there are limitations in what we can create. And one of the limitations is in size. We measure the width of their breast, and the implant has to fit in that width, just like your foot has to fit in your shoe. And so if the implant that they choose is too wide, it will either be in their armpit, or it'll be in the middle of their chest for a uniboob, or it will wrinkle when we put it in because it'll curl up. And so what we want the implant to do is to fit into the space. And within that dimension, there will be multiple choices that they have regarding size. I believe that it's very difficult to make a really large breast shapely. And so for me, it's a competition between shape versus size. Had you rather have a bigger breast that's maybe not quite as shapely, or would you rather have a smaller breast that's shapely? Really, I believe that for shape purposes, the woman should choose the smallest implant that she's willing to have regarding shape. For size purposes, just get what you want. But at some level, bigger is less shapely. And I don't know exactly where that line is, but what we do is with photos and with conversation, we try to create a beautiful breast. I can also tell you that what you get with a breast augmentation is a bigger version of the shape that you have. So that if you come in with a shapely breast, it's very easy just to put an implant in it and you get a bigger version of a shapely breast. If you come in with a poorly or difficultly shaped breast, it's very difficult to make a shapely breast out of an unshapely breast. Sometimes you have to do a lift, sometimes you have to make more incisions. And so there's also the choice of scars. What kind of scars are you willing to have regarding making a beautiful shape? I think that the biggest concern that women have is that it's going to be too obvious that it's a fake implant. I believe that the bigger you go, the more obvious that it's going to be. What I think you want to avoid is the high implant and the domed look. And the bigger you go, the higher the implant's going to go. Look at it like you're filling up a bucket with water. The more you put in it, the higher it's going to go. And the higher it goes, the more domed it's going to look. And the higher the implant sits, the lower the nipple is going to look on the breast. And so you can't have a perky looking breast with an implant way up here at the clavicle. There's what you look like in clothes, and then there's what it looks like naked. And I can tell you that if the implant is way up here high, there's no way that the nipple is going to look perky on that breast. And so what we do is we talk about all these issues, and I think the woman can choose, and I think they're the best chooser because they're the ones that has to wear it. I have an opinion, of course, regarding what a shapely breast is, but they're the ones that have to wear it, and so they're the ones that choose. Go ahead and hit the like button if you enjoyed this video, and feel free to share with a friend. You can stay up to date with the latest in cosmetic surgery by subscribing to the Austin-Weston YouTube channel. And for more information on the Austin-Weston Center, visit our website at austin-weston.com or click the link in the description below.